As a brain doctor, I'm shocked this vegetable raises stroke risk overnight. If you are over 60 years old, there is something right in your refrigerator, something you have been told all your life is healthy, that can quietly increase your risk of stroke while you sleep. No chest pain, no warning signs. One minute you feel perfectly fine, the next you may struggle to speak clearly, be unable to raise your arm, or lose your balance. Have you ever wondered if everything we have long called healthy food truly suits our aging bodies? How can we tell when a vegetable, a food recommended for lifelong consumption, might actually become a dangerous enemy? Today, I will reveal to you 9 common vegetables, very popular in the diets of Americans over 60, which, if eaten improperly or at the wrong time, can silently increase the risk of stroke and other brain-related problems. If you haven't subscribed to the channel yet, please click the subscribe button and turn on notifications so you don't miss these important health tips tailored for you. If you find this video helpful, comment with the number 1 so I know you're watching. Now, let's begin with the first vegetable, spinach, a food that can unexpectedly stiffen your blood vessels and raise your stroke risk.
1. Spinach. Have you ever thought that a plate of boiled spinach could affect the blood flow in your brain? I know it sounds extreme because we've been taught all our lives that leafy greens are the epitome of health. But the story of Mrs. Linda, 68 years old, will make you see this familiar dish in a new light. Mrs. Linda has hypertension and was prescribed vitamin D along with calcium supplements to protect her bones. Every evening, she ate a serving of boiled spinach, believing it was good for her cardiovascular system. But just a few months later, tests showed her blood vessels beginning to show signs of calcification, a condition doctors call arterial calcification, which can increase stroke risk. Are you wondering how a vegetable could cause this? The truth is that spinach is very high in oxalates, a compound that, when combined with high doses of calcium supplements, can form insoluble crystals. These crystals hinder the absorption of calcium necessary for bone health, and worse, facilitate calcium deposits in the blood vessel walls. According to a 2019 study published on PubMed, people taking calcium supplements at doses greater than 1,000 milligrams per day without accompanying vitamin D had twice the risk of ischemic stroke compared to normal individuals. You see, not all supplements are harmless when combined with healthy foods. So, what is the solution? Experts recommend that people over 60, especially those taking calcium or vitamin D supplements, should consume spinach in the morning or at lunchtime and should boil it once and discard the water to reduce oxalate content. Have you ever noticed how simply changing the timing of eating can turn a potentially harmful food into a safe one? But notably, spinach is not the only vegetable that can have adverse effects if eaten at the wrong time or combined improperly. There is another vegetable, often grown right in home gardens, which can reduce the effectiveness of blood thinners, causing blood to thicken and increasing the risk of vascular blockage. Can you guess which vegetable this is?
2. Broccoli. While spinach makes you reconsider oxalates and calcium, broccoli raises a different question. Can a nutrient-rich vegetable silently alter the effectiveness of the medications you take daily? Mr. Harris, 72 years old, is a typical example. He has atrial fibrillation and must take warfarin, an anticoagulant, to prevent blood clots. For many months, his INR levels remained stable. But everything changed after he decided to eat steamed broccoli nearly every evening because he read somewhere that it is good for the brain. Just a few weeks later, tests showed his INR dropped, meaning his blood thickened and his stroke risk increased. Have you ever thought that eating more broccoli than usual could actually thicken your blood? The cause lies in vitamin K, a nutrient essential for blood clotting. For healthy individuals, this is good news. But for those on blood thinners, like warfarin, sudden increases or decreases in vitamin K intake can disrupt the delicate balance maintained by the medication, causing blood to clot faster or slower than is safe. According to guidelines from the University of Iowa, warfarin users do not need to completely avoid green vegetables, but must maintain a consistent daily intake of vitamin K and avoid sudden changes. This means if you want to eat broccoli, consume it in similar frequency and amounts each week rather than binge eating it for several days straight. Interestingly, many people think only drugs interact with other drugs, but foods, especially vegetables, can have a much deeper impact than you might imagine. Are you curious whether there are other vegetables that interact with medications in entirely different ways, causing blood pressure to drop rapidly within minutes?
3. Romaine lettuce. Have you ever eaten a refreshing plate of romaine lettuce in the evening, thinking you just did something good for your health? Mrs. Evelyn, 70 years old, thought so too. After dinner, she would usually sit and watch the news, then go to bed feeling light and satisfied. But in recent weeks, she began waking up in the middle of the night with dry mouth, a rapid heartbeat, and sometimes leg cramps. Would you believe the cause was the romaine lettuce she ate every evening? In fact, romaine lettuce, besides being high in water content, also has a mild diuretic effect. This means it can cause your body to excrete more water in the hours following consumption. For younger people, this is usually not an issue. However, for those over 60, especially those who have consumed little water during the day, this nighttime diuretic effect can lead to temporary dehydration, making the blood thicker. And as you know, thicker blood significantly increases the risk of blood clot formation, a major factor leading to stroke. A cardiologist at Mayo Clinic explained that nighttime dehydration not only increases blood viscosity, but can also cause blood pressure to rise the next morning, the time already known as the peak hours for stroke incidents. So why not simply drink more water when eating lettuce? The problem is that older adults often have a reduced sense of thirst, making it easy to neglect rehydration after dinner. You might be wondering, if a vegetable seemingly as harmless as water carries such risks, what happens when we eat a sweet, crunchy root vegetable that can cause significant blood sugar fluctuations during the night?
4. Raw carrots. Do you have the habit of eating a few raw carrot sticks in the evening, thinking you're healthily supplementing vitamins and fiber? Mr. Martin, 66 years old, did the same. After dinner, he would often peel some carrots and snack on them while watching his favorite TV show. But just 1 month later, he began noticing that he often woke up at night with a rapid heartbeat and occasional mild headaches. Have you ever thought that the sugar in raw carrots might be related to this? The fact is, raw carrots have a low to moderate glycemic index, but when eaten at night, especially by people with diabetes or prediabetes, the slight rise in blood sugar can stimulate the pancreas and nervous system, causing nocturnal blood sugar fluctuations. For some, the subsequent hypoglycemic reaction causes the body to release stress hormones like adrenaline, leading to increased heart rate and vasoconstriction. And as you know, vasoconstriction at night is one of the risk factors for blood clot formation. A study published in the Journal of Clinical Endocrinology and Metabolism showed that blood sugar fluctuations, not just high blood sugar levels, increase the risk of cerebral vascular damage. This is especially important for people over 60, as their ability to regulate blood sugar usually declines. So does this mean older adults must completely avoid carrots? Not necessarily. The simple solution is to eat them during the day or combine them with healthy fats like olive oil to slow sugar absorption. But if raw carrots can cause blood sugar fluctuations, there is another common seasoning, often praised as a natural miracle, that has the opposite effect. It thins the blood,
and when combined with anticoagulants, can significantly increase the risk of brain hemorrhage. Can you guess what it is?
5. Garlic. Have you ever thought that the familiar kitchen seasoning, one that everyone believes to be a miracle for cardiovascular health, could become dangerous if eaten improperly? Mr. Robert, 70 years old, believed that eating a few raw garlic cloves daily was the best way to prevent blood clots. He maintained this habit for many years until one morning he woke up with a severe headache and had to be hospitalized for a brain hemorrhage. Are you curious what happened? Garlic contains allicin, a compound with natural blood-thinning properties. For healthy individuals, this can be beneficial, helping reduce the risk of thrombosis. But for those on anticoagulants like warfarin, apixaban, or high-dose aspirin, this synergistic effect can cause excessive blood thinning, leading to intracranial bleeding or gastrointestinal hemorrhage. A study published in the Journal of Clinical Pharmacology warned that high doses of garlic, especially raw or concentrated extracts, can significantly prolong bleeding time in patients taking anticoagulant drugs. The issue here is not just to eat or not to eat, but how much and when to eat it. If you enjoy garlic, consume it in moderation and inform your doctor, especially before surgery or medical procedures. This could be the difference between a beneficial habit and a serious health risk. Isn't it surprising that a food can be both medicine and poison, depending on the context? But garlic is not the only vegetable that can cause sudden blood pressure changes. There is another root vegetable, often included in stir-fries or salads, that can cause your blood pressure to drop so quickly you feel dizzy within minutes. Can you guess what it is?
6. Onion. Have you ever peeled onions, tears streaming down your face, yet smiled because you believed it was one of the best vegetables for heart health? Mr. Daniel, 74 years old, was just like that. He loved adding raw onions to his evening salads, convinced they helped lower blood pressure and cleanse his blood vessels. But one summer evening, just minutes after finishing his meal, he felt dizzy, stood up to find the room spinning, and then collapsed to the floor. Would you believe the cause was a few slices of onion? Onions contain many sulfur compounds and flavonoids, especially quercetin, which have vasodilatory and blood pressure-lowering effects. For people with hypertension, this is good news. However, for those over 60, especially those taking antihypertensive or diuretic medications, the blood pressure-lowering effect of raw onions can synergize with these drugs, causing blood pressure to drop too quickly. When blood pressure falls suddenly, cerebral blood flow decreases, leading to dizziness, fainting, or even loss of consciousness. And, as you know, falls at this age are dangerous not only because of injury, but also because they can trigger cardiovascular events. Several clinical reports have noted that consuming large amounts of raw onion can cause temporary hypotension even in healthy individuals, and the drop is more pronounced if the body is already primed with blood pressure medications. So should you avoid onions completely? Not necessarily. The safe solution is to eat cooked onions, include them in lunch or breakfast meals, and avoid consuming large quantities of raw onions just before bedtime. Have you noticed that the timing of eating is just as important as the food itself? But if onions can cause blood pressure to drop, there is another sweet, golden, familiar staple in family meals that quietly causes spikes in blood sugar and blood pressure. Can you guess what it is?
7. Corn. Sweet, fragrant, golden corn. Just hearing about it makes you think of a perfect summer meal. Mrs. Carroll, 69 years old, often cooked a pot of boiled corn in the evening, enjoying it while chatting with her family. But just a few weeks later, she realized she frequently woke up at midnight with a rapid heartbeat and occasional dull headaches. Have you ever thought that a sweet ear of corn might be related to this?
Corn is a natural source of starch rich in carbohydrates, and although it is not as sharply sweet as refined sugar, it can still cause a fairly rapid increase in blood glucose, especially if eaten in the evening. For people over 60, especially those with diabetes or prediabetes, nocturnal blood sugar fluctuations can stimulate the nervous system and cause blood pressure to reactively rise. This creates a dangerous cycle: rising blood sugar, rising blood pressure, greater vascular stress, increasing the risk of vessel rupture or blockage. A study published in the American Journal of Clinical Nutrition indicated that a starch-rich dinner can reduce sleep quality and cause greater blood pressure variability during the night in older adults. The safe solution? If you want to eat corn, enjoy it during the day and combine it with protein or healthy fats to slow sugar absorption. Isn't it fascinating how simply changing the timing of eating can make a familiar food much safer? But corn is not the last vegetable on this list. There is still a slender green sprout known as a body detoxifier, but when eaten at night, it can cause you to wake up frequently to urinate, inadvertently increasing the risk of thicker blood and blood clots. Can you guess what it is?
8. Asparagus. Asparagus, often hailed as the queen of green vegetables, commonly appears in healthy meals for those focused on wellness. Mrs. Susan, 67 years old, developed the habit of eating a plate of lightly steamed asparagus before bed, believing it helped detoxify her body. But after just a few weeks, she noticed waking up regularly at 2 to 3 a.m. to urinate, followed by a heavy, slightly dizzy feeling the next morning. Have you ever experienced this? The cause lies in asparagus's natural diuretic properties. The compound asparagine in asparagus stimulates the kidneys to increase urine production. When eaten at night, especially if water intake during the day is low, this forces the body to lose additional water overnight. For people over 60, nighttime dehydration means thicker blood, slower circulation, and a higher risk of clot formation, especially dangerous for those with a history of stroke or heart disease. Cardiology experts also note that nighttime diuresis can disrupt deep sleep cycles, making morning blood pressure more prone to fluctuations. A simple way to reduce this risk is to eat asparagus during the day and maintain adequate hydration throughout. But as you see, not everyone realizes that a detoxifying vegetable can trigger such adverse reactions if eaten at the wrong time.
9. Tomatoes. Tomatoes, a red, mildly sweet, refreshing fruit, are almost always present in every kitchen. Mr. Henry, 71 years old, ate a bowl of tomato salad with olive oil every evening, believing it was an excellent choice for heart health. But one night, after finishing his meal and sitting down to read, he suddenly felt his face flush, heart racing, and minutes later experienced a severe headache accompanied by mild numbness on one side of his face. He panicked, thinking he was having a stroke, but medical tests showed otherwise. Can you guess what happened? Tomatoes contain histamine, tyramine, and small amounts of solanine, compounds that can affect blood vessels and the nervous system in sensitive individuals. Histamine and tyramine can cause sudden vasodilation or vasoconstriction, leading to blood pressure changes, facial flushing, headaches, and even stroke-like symptoms, known as stroke mimics. For people over 60, especially those with cardiovascular conditions or previous strokes, these reactions can cause confusion and lead them to overlook real danger signs. Studies on migraines and vascular disorders have shown that tyramine in foods can trigger vascular headaches, especially when consumed at night or when the body is fatigued. So, should you completely avoid tomatoes? Not necessarily. The solution is to eat them during the day instead of at night, or combine them with magnesium-rich foods to help stabilize blood vessels. And now, You see, even the most seemingly harmless vegetables can carry hidden risks if eaten at the wrong time, in the wrong way, or combined improperly. But the more important question is, how can you enjoy the benefits of vegetables while avoiding these negative effects? The answer lies in the summary section, coming right up, where I will share safe eating principles specifically designed for people over 60 to protect their brain and heart for many years to come. You see, not all vegetables are absolutely safe, especially once you are over 60, taking medications, or have underlying cardiovascular conditions. Spinach can combine with calcium supplements to create calcified plaques in blood vessels. Broccoli, rich in vitamin K, can disrupt the effectiveness of blood thinners. Romaine lettuce and asparagus have mild diuretic effects, causing blood to thicken at night. Raw carrots and sweet corn cause blood sugar fluctuations. Garlic and onions can lower blood pressure or thin the blood excessively. Even tomatoes, the seemingly harmless fruit, can cause sudden vascular contractions in some individuals. This does not mean you must eliminate these foods entirely from your diet. The key is to eat them at the right time, in the right amounts, and understand how they interact with your body and medications. Eating them during the day instead of at night, boiling and discarding water to reduce oxalates, maintaining a consistent vitamin K intake, combining with protein or healthy fats to slow sugar absorption. All these principles help you harness the benefits of vegetables while minimizing risks to your heart and brain. I know changing eating habits is not easy, especially when you have been doing it one way for decades. But remember, one right choice today can save you from a medical emergency tomorrow. And if you have ever experienced or witnessed a stroke, you will understand that prevention is always much easier than treatment. Now, I want to hear your story. Have you ever been surprised to discover that a healthy food was actually harmful to you? Please share in the comments so we can all learn and protect each other's health. And if you found this video helpful, send it to a friend or family member. Perhaps that action could help them avoid a serious health risk. In the next video, I will share 5 safe vegetable eating tips for people over 60, so you can enjoy fresh flavors while confidently protecting your brain and heart. Would you want to miss that?